Welcome to the EADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights articles in a section called Editor's Picks, and today we explore the Editor's Picks for September 2024, selected by the JEADV Associate Editor, Professor Roland Goulay. Predicting treatment response in psoriasis and atopic dermatitis, making sense of contact dermatitis, and anti-interleukin-31 nemolizumab cures rare form of perforating collagenesis. But before we start, a reminder for you.
If you're a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you're interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode.
And now, the editor's picks. Article 1. Predicting treatment response in psoriasis and atopic dermatitis. Two articles in this issue tackle the costly, risky problem of predicting treatment response in inflammatory dermatoses. Pezur et al. Analyzed serum proteomic and microRNA as well as skin microbiota data during anti-interleukin-4Ra therapy in patients with atopic dermatitis. They found that serum CCL17, CCL13, and E-selectin correlated positively with SCORAD, pruritus, and BSA, while BDNF levels correlated negatively with BSA. Interestingly, neither the serum miRNA expression nor baseline bacterial skin composition in AD seemed to be associated with treatment outcome. In addition, baseline values of Notch1 to CD25's ratio and CCL17 to E-selectin ratio were the best performing predictors of low response to dupilumab after 6 months of therapy. Moreover, Munoz-Aceituno et al. Studied the association of 180 single nucleotide polymorphisms in peripheral blood cells of patients with moderate to severe plaque psoriasis with response to secukinumab therapy. Combination of different SNPs, either alone or along with weight and history of biologicals, had modest sensitivity, approximately 50%, but high specificity, approximately 95%, to discriminate between responders and non-responders at 6 and 12 months of secukinumab therapy. These are promising findings for personalized therapy in patients with inflammatory skin conditions. Article 2. Making sense of contact dermatitis. The EADV Task Force on Contact Dermatitis gives practical tips on how to approach patients with clinical signs and symptoms suggestive of this highly prevalent condition, including initial diagnostic tests. Apart from well-known entities like irritant contact dermatitis, allergic contact dermatitis, and photoallergic or phototoxic contact dermatitis, the authors also describe newly emerging forms of atopic contact dermatitis, such as ACD by proxy or protein contact dermatitis. In addition, a section is dedicated to contact dermatitis mimics, conditions that clinically resemble contact dermatitis such as inflammatory, infectious, and genetic conditions including atopic dermatitis, seborrheic dermatitis, psoriasis, scabies, and cutaneous T-cell lymphoma. Article 3. Anti-interleukin-31 nemolizumab cures rare form of perforating collagenesis. Reactive perforating collagenesis is a transepithelial elimination disorder where altered collagen extrudes through the epidermis. In their paper, Yamada and co-authors present a rare case of giant-acquired RPC in a patient with worsening diabetes mellitus and epidermal growth factor receptor-mutated lung cancer. Using the anti-interleukin-31 treatment nemolizumab, not only subjective symptoms like frequently occurring pruritus abated, but also the clinical and histological signs of RPC significantly improved or disappeared. Thus, targeting the inflammatory pathway in other transepithelial elimination disorders could be a potential new avenue for treatment in this group of rare skin diseases. Just to recap, our first editor's pick was based on two articles, Proteomic miRNA and Bacterial Biomarker Patterns in Atopic Dermatitis Patients and Their Course Upon Anti-Interleukin-4R Alpha Therapy by Pezur and co-authors, and Pharmacogenetic Biomarkers for Secukinumab Response in Psoriasis Patients in Real-Life Clinical Practice by Munoz-Aceituno and co-authors. Our second editor's pick was Differential Diagnosis of Contact Dermatitis, a practical approach review by the EADV Task Force on Contact Dermatitis by Pasquet and co-authors. Our third editor's pick was A Giant Variant of Acquired Reactive Perforating Collagenesis Successfully Treated with Nemolizumab by Yamada and co-authors. As you know, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and although you can find free access and open access articles, EADV members benefit greatly by having access to all of the articles and content. We would like to give a special thank you to all of our listeners, and if you haven't already, make sure you subscribe on Apple Podcasts, follow us on Spotify, or you can find us on any major podcast provider. It really supports our channel. And we appreciate you joining us and look forward to presenting more interviews, research, and topics of merit. Until the next episode, take care of your skin.